Fibroids are very common muscle tumors of the uterus. We know that over the course of a lifetime, probably close to 70% of Caucasian women and 80%, more than 80% of African American women will develop fibroids. Now, the vast majority of women that develop fibroids have no issues. They're found incidentally. Up to a quarter of women will actually have some symptoms that will bring them in to seek a physician's evaluation. If you're having symptoms from fibroids, there will typically be heavy bleeding or pain or pressure symptoms, sometimes increased urinary frequency. The options for managing fibroids include watching and waiting, medical management, or interventional radiology procedures and surgery. Brigham and Women's Hospital has all of these options available. Most fibroids are usually discovered during a pelvic exam, either in the primary care provider's office, if the primary care provider does the pelvic exam, or in the annual gynecologic exam. And this often triggers an ultrasound or some imaging modality to get a sense of the size and location of the fibroids. Alternatively, some women will present with symptoms that trigger this evaluation, whether it's the heavy bleeding or the pressure or the pelvic pain that triggers an imaging that will lead to diagnosis of fibroids. Medical management is typically geared for abnormal bleeding symptoms. Most of the medications in that group affect bleeding but do nothing for the size and the bulk type symptoms that patient has. The only medication that is widely used that affects size and bleeding is the Depo-Lupron injection. Overall, medical management of fibroids is not as well studied as other interventions for fibroids. We know that it's sort of a band-aid, and a lot of patients will respond to the medical management, but their symptoms will return once they discontinue these managements, and often they will end up needing some other intervention in the future. The next set of options for patients are procedures done by our interventional radiology physicians. These procedures, there are two common procedures, and both of these procedures are offered at the Brigham and Women's Hospital. The most common procedure is uterine artery embolization or uterine fibroid embolization. Essentially, they target the blood vessels that feed the uterus and occlude those vessels. This leads to a decrease in blood supply to the fibroid and overall shrinkage of the fibroid and the size of the uterus. And the patient will notice usually a decrease in bulk and in bleeding symptoms after these procedures. The other option performed by our interventional radiologists is the magnetic resonance guided focused ultrasound. To qualify for a magnetic resonance guided focused ultrasound, the fibroids usually have to be of a certain size, usually limited to one fibroid, and usually in the perfect spot, meaning that they can be behind the bladder or they can be behind the bowel, because the energy of the ultrasound that's used can damage those important structures if they're not properly located. The options for surgery include removing the fibroid or removing the uterus. Now, removing the fibroid can be approached in several different ways. If the fibroid is located completely inside the cavity of the uterus, that can be removed by an approach called hysteroscopy, where the camera and equipment are placed through the cervix in the operating room and the fibroid is shaved down from inside the cavity. If the fibroid is located in the wall of the uterus, this can be approached by either an abdominal incision, similar to an incision for a C-section, side to side in the skin or up and down in the skin, and the fibroid is typically removed that way. Alternative routes to the open incision include laparoscopy or robotic surgery. Both these techniques include placing small incisions in the wall of the abdomen to remove the fibroids. The other surgical option is performing a hysterectomy. A hysterectomy can be performed vaginally if the size of the fibroid is small enough. With large uteri with large fibroids, oftentimes the hysterectomy is performed with a big incision on the abdomen or laparoscopically or robotically as well. Fibroid surgery can be performed by a general OBGYN. It can be performed by a minimally invasive gynecologic surgeon like myself. It can be performed by a reproductive endocrinology and infertility specialist, as well as a gynecologic oncologist, depending on the availability closer to where you are.